Hi guys, it's Eddie here, orthotics consultant and sports massage therapist at Banbury Spine and Health. And today we're going to have a little look at dry needling. Many of our practitioners and therapists here at the clinic are qualified in dry needling, and we use it to treat a wide range of conditions, including knee pain, low back pain, shoulder problems, even headaches, migraines, and sciatica as well. Often we use it as a treatment sort of alongside other modalities such as sort of chiropractic and massage therapy, but it's also effective as a standalone treatment for muscular pain as well. However, a question we get asked quite a lot is what's the difference between dry needling and acupuncture? So there are some similarities between the two practices. Both dry needling and acupuncture use similar types of needles. Typically these are very thin, usually around about 1/4 of a millimetre in diameter. They're non-hollow needles that are then inserted into various points in the body. In fact, the sort of name dry needling comes from the fact that the needles aren't used to inject any fluid, so essentially they are dry. I've got a little pack of needles here actually, which I'll show you quickly, so you've got an idea what they look like. If you do have a particular phobia of needles though, you might want to look away now. But in clinic we tend to use either 25 or 40 millimetre long needles. It depends which area we're needling really. So these are the 25 millimetre needles, but as you can see they are very thin. And so the differences between the two practices is really in the teachings behind them, to be honest. Acupuncture follows the teachings of traditional Chinese medicine, in which it's believed there's a life force or there's qi that flows through the body, and that is interconnected by meridian lines. And then any sort of disruption or imbalance of the qi is believed to then cause ill health. So the needles are actually inserted into certain points along these meridian lines with the aim of achieving balance, restoring the normal flow of qi, and thus ensuring a return to normal health. Dry needling, on the other hand, is really can be thought of as sort of Western form of acupuncture. And the needles themselves are often actually inserted into specific points within the muscles, known as trigger points. And so trigger points are often sort of these tight nodules located within tight bands of muscle. They're often hyper-irritable points within the musculature, which can cause either localized or referred pain and discomfort. And so the aim of inserting the needles into these specific points is actually to stimulate the body's natural healing response in order to release that trigger and then restore normal function and thus reduce any pain that trigger point may have been causing. The needles could also be inserted generally into specific muscles with the aim of reducing sort of tightness and tension. And typically the needles can be left in for anywhere between 5 and 15 minutes. It really depends on how acute or chronic a condition we're treating. And so hopefully that answers some of the questions that you guys have surrounding dry needling. Of course, you can always chat to your practitioner or therapist if you'd like some more information on it. But that's pretty much all from me. So look after yourselves and I'll see you soon. Bye.